My name is Ann Palmer, and I'm a program director at the Center for Livable Future, and I work on the Food Policy Networks project. And joining me today are Karen Bassarab and Rachel Santo. We are delighted to have with us today 4 presenters who are going to talk about their role in the COVID-19 epidemic. We have Milele Kennedy, who's the Food Policy and Program Coordinator for the City of Indianapolis. We have Freishtat, the Baltimore City Food Policy Director. Edwin Marty is the Food Policy Manager for the City of Austin. And Latha Swamy is the Director of Food System Policy for New Haven, Connecticut. Before we begin the presentation, I'm going to briefly go over a few features of Zoom. Although at this point in the pandemic, it seems probably a little bit redundant since we're all kind of zoomed out. You will all be muted. You'll be muted throughout the entire discussion. If you have a question at any point, you can type it in the Q&A box, or you're also welcome to put it into the chat box. Some of you sent in questions ahead of time, and presenters will take time to answer some of those. There were quite a few questions. If you have any issues with sound, please send us a message via the chat box that's located above the floating toolbar. And you can also share resources and other items in that chat box as well. We're going to be recording the discussion today, and we'll share it with everyone that registered in the coming week. As I mentioned before, this is hosted by the Center for Livable Future, an interdisciplinary center located at the Johns Hopkins Bloomberg School of Public Health. Our work focuses on the intersection of diet, environment, food production, and public health. The Food Policy Networks project is one of the projects with the goal of building the capacity of food system stakeholders to reform local, state, regional, and tribal food systems through effective public policy. We do that through training, sharing best practices, networking with all other food policy groups and leaders, and developing and providing food policy resource materials. If you aren't familiar with our website, we encourage you to go ahead and sign up to the listserv, and you can take a look at all the resources we have available. This is the website interface. I am going to take a moment to mention that we are going to be hosting a national forum for food policy councils. It was originally scheduled for November of this year. We have postponed it till September of next year, September 20th through the 22nd. There's a rather awful little link down here. It's pretty long, and we will send that out also so you can sign up to get more information about that forum. So I am going to introduce our distinguished panel here. So Milele came from the Indy Parks as the USDA Food Program Grant Manager. Her primary role was state and federal food program management and creating partnerships with organizations to feed hungry youth in Marion County. Previously employed by the Department of Defense, she has extensive experience in strategic development, program assessment, and accreditation. Milele is a member of several organizations, including the Indy Food Council, Top 10 Coalition, Food Systems Leadership Network, and the National CACFP Sponsors Association. She's a Lean Six Sigma Yellow Belt with 2 Mayor's Performance Awards, the 2017 Best of Indiana Award, and the 2018 USDA Gold Award for Quality. A native of Indianapolis, she also enjoys parasailing, traveling with her family, and exploring Indiana trails with her 2 dogs. In 2010, Holly created the Baltimore Food Policy Initiative, an intergovernmental collaboration that aims to address food system policy. She spent over 2 decades working on food issues in a variety of contexts, experiences that have provided her with an understanding of the food system from the perspective of a food policy strategist, nutritionist, educator, and a grower. Holly got her master's from Tufts University in Applied Nutrition and is a Kellogg Food and Society Policy Fellow. She has received the Mayor's 2016 Medallion for Meritorious Service Award, honored as one of Maryland's Daily Record's top 100 women in Maryland, and the city received the highest award for the implementation of the Milan Urban Food Pact in 2016. Edwin earned a BA in anthropology from the University of Oregon and completed an apprenticeship in agroecology from the University of California, Santa Cruz. He went on to work on sustainable farming projects around the world, including Mexico, Mongolia, Australia, and Chile. Edwin worked for Southern Living magazine as a garden writer and was the founder and director of a nonprofit called Jones Valley Teaching Farm, located in Birmingham, Alabama. Edwin has consulted on numerous urban farm projects around the country, helped establish the Alabama Sustainable Ag Network, and co-authored a book about urban farming in America called Breaking Through Concrete, published by the University of California Press. And last but not least, Latha Swamy joined in September of 2018 as the Director of the Food System Policy for New Haven. In this role, Latha works to support and help manifest community-led efforts that envision and create environmentally sustainable and socially just alternatives to our current dominant system. Latha also serves as a senior advisor to the chair of the Rockefeller Foundation Economic Council on Planetary Health, where her work broadly examines the relationship between environmental degradation and human health. She's also trained in urban farming and food justice practices at Just Foods New York's Farm School. She holds a master's of urban management from Yale University, prior to which she pursued an MD and a PhD in systems neuroscience at Albert Einstein College of Medicine. So as you can tell, they have very different backgrounds, but are all in very similar positions. So we are really excited to have them all be presenting with you today. So I am going to turn it over to Milele, who is going to start her presentation.
Hi, I am glad to be here today. I'm going to go ahead and share my screen here. Here we go. So just to start off, I am the Food Policy and Program Coordinator for the City of Indianapolis. I am part of the Office of Public Health and Safety, which was a new office created in 2016 by our then new mayor, Mayor Joe Hogsett, specifically to be able to address some public safety initiatives that we had in our city. So the office was focused on policy efforts around several different areas, food security being one of those, as part of a comprehensive criminal justice reform. I am the second food policy and program coordinator for the city. And my goal has been to be able to connect with residents, community organizations, and businesses, specifically to address food access and insecurity and food economy in our city. Just to give a little bit of a background about Indy, Indianapolis has, or the Indy metro area has around 890,000 people. 22% of those residents are food insecure. Another approximately 300,000 residents have food access issues within our city. Marion County residents, a large proportion of them live within food desert areas. And we have a real lack of access to grocery stores within Indianapolis. We have been cited as being, one of the largest food desert areas per capita in the U.S. So this is kind of where we were starting out before COVID-19, and knowing that we had those deficits to begin with. We had some pre-COVID policies and funding in place. We were really trying to have a multifaceted approach to the food policies that we had in Indianapolis. And so that was to create a balance between policy and research that would be based on specific metrics that we could develop to be able to guide the work that we were doing moving forward. So we had several supporting city agencies with food programs that were already in the works, but they were all siloed. We didn't have any real connectivity between the work being done in different departments within the city. We were really wanting to promote local food and our local ag, especially our community gardens and our urban farms. So those were, we wanted to foster relationships between our local businesses and the community around those, and to promote economic development. And really just build capacity among our community members and organizations in all of these different areas. So in 2019, Mayor Hogsett enacted the Indy Food Fund, which is a $500,000 investment directly from the city county budget that would be dedicated specifically to addressing these food issues. This is the first time that this has been done in Indianapolis, so there was never a budget specifically dedicated to this until 2019. What we used the Indy Food Fund for to begin with were a few programs that we thought could really stand up these initiatives that we wanted to work on in their community. And the biggest one of those was Community Compass, which is food assistance technology. So it is an app, but it's also has SMS texting. It can be accessed online. It can be accessed by phone. And what it was intended to do was really to provide information on both immediate or urgent food needs, as well as ongoing food assistance, all in one place. And so Community Compass launched in January, which was perfect timing. We couldn't have planned it any better to have this out. And then we had a real media blitz and launch for the Community Compass app to make sure that all of the community members were aware of this. Another program is the Neighborhood Food Champions program, and that was pre-existing, although we dedicated additional funding to this program to be able to give residents specific funding and support around developing projects that address their specific food access and insecurity needs in their communities. So it's really meant to be a grassroots, community-based incubator type program. And then our third program that we focused on pre-COVID was the Lift Indy Grocery Access Program. And so Lift Indy was meant to provide people that lived in food deserts with rides to and from their nearest grocery store. In Indianapolis, in some of these areas, the nearest grocery store could be as much as 5 miles away. And so we wanted to make sure that those families that were really struggling in those areas had some type of support. We started off with one area and then had expanded pre-COVID to the 2 largest food desert areas within Marion County. So Operation Feed Indy came up before we really knew the expanse that COVID-19 would have on our community, the impact that it would have. But we knew right away that we needed to get some things stood up very quickly. Well, one of the things that we had available was that we already had both the Indy Food Council, which is run through my office, the Office of Public Health and Safety, and we also had the Indy Hunger Network, which is a mostly a food insecurity based organization working to support our local food banks and some other agencies within Marion County. So we had the partnerships already started, and these are some of the things that we were able to get up and running within 2 weeks to coordinate through Operation Feed Indy. These were warehousing and distribution centers, which we found out very quickly we would need because of the amount of food coming in due to the closure of restaurants. We had a large number of distributors wanting to donate food, most of it perishable items, but we didn't have a way to get it in and out. So our warehousing and distribution center was set up in our football stadium in Lucas Oil Stadium. Bankers Life Fieldhouse, which is where the Indiana Pacers would usually play, we put to use to be able to get our homeless neighbors food distribution program set up. That was another area that we knew that we needed to commit enough resources to because of the need for social distancing. Two other things that came along out of those two were our pop-up food distribution sites. These were large sites that had a little over 4,000 families participating each day that they were open. So one was at the Indianapolis Motor Speedway, where we would normally have the Indy 500. And the other was the Indiana State Fairgrounds, where we would generally be preparing for our state fair. And so these are all areas that were closed due to COVID-19, but we were able to utilize them, these large scale distribution centers, using those. One other thing, or two things that we did to support the community at their home was to expand the Lyft Grocery Access Program to all of Marion County. So all Marion County residents were able to receive $1 rides to and from the grocery store. And then also the home delivery meal program, which was designed specifically to provide those supports for families that had either a lack of transportation or were quarantined or had someone in their family that may have been at risk. So we really wanted to make sure that we got those meals delivered out to the homes. And so within a month, by the beginning of April, we were able to stand up the home delivery meals program. Funding was a really big part of this. We originally needed to rely on our CSRF funding, which was stood up really quickly through our United Way agency partners. So all total, the Indy Hunger Network and our partner agencies were able to get $4 million throughout 3 rounds of CSRF funding, which started at the end of March and had additional rounds in April and May. In addition to that, we did have additional funding through our FEMA, and that funding totaled just a little over $3 million that we have applied for. We have not received it yet, but we do have contracts in place now with our agencies to be able to reimburse them for all of their COVID-19 funding, which for us started here in Marion County starting on March 6th, was our emergency declaration. So those are the 2 funding sources we've used. Like I said, the CSRF funding, our local philanthropic funding, came in first. And so that was on a month-by-month basis. And now that we have our additional funding available, that'll be going out to provide both retroactive support and future support until August. One other thing that I wanted to bring up, just specifically because we've had so many questions about it, was the opening of our farmers markets. And so that was one additional policy that we put into place very specifically in order to have residents still able to get out and receive their fresh produce and dairy. And so this is our farmers market policy, just a kind of an overview of what our farmers market policy looks like. And then I know that there were a few questions that came out beforehand. And so I was gonna address a couple of those questions that I knew very specifically related to what we were doing here in Indianapolis. One of the questions has been, a lot of questions have been around racial equity. And we did have in Indianapolis, starting in December, a governmental approach to race equity steering committee in place that had been meeting in order to really address some of the disparities that we'd seen within Indianapolis. These were initially just kind of in the beginning stages of fact finding. So our steering committee started in December, and the city county council really was promoting and really supporting us to continue in this work. We're centering things around race equity. Like I said, we started with the GARE steering committee, but just this month, we have a new resolution out from the city county council recognizing racism as a public health emergency. And by doing that, there were some very specific measures in that resolution related to food access and food insecurity. And so that allows us to really target some of those initiatives that we started at. There's a couple of other questions that we'll have that we can address at the end, but those are two very specific policy items that Indianapolis has put in place in the last 6 months. And so I wanted to make sure that I had a moment to share that with everyone. So, and that is everything that I have in my presentation.
Great. So thanks, Milele. I'm gonna, Holly, I'm gonna open yours up. Is that screen showing up or not?
Not yet.
Okay, hold on. Maybe because I have two up here.
Good afternoon, everyone. I'm Holly Freishtat, Food Policy Director for Baltimore City. Next slide, please. I want to start with the Baltimore Food Policy Initiative has been in place for 10 years. So we already have the existing staffing structure. Myself, a food resilience planner, a food access planner, and a food systems planner that happened to start this April, which was very good timing. We already had a stakeholder engagement looking at the emergency food working group that then led to our Baltimore Food System Resilience Advisory Report that we did in collaboration with Johns Hopkins. That was our baseline for our response for the COVID-19. Next slide, please. And you can see here, this is the wheel, and it's supposed to look complicated because it is. We have 12 city agencies working on COVID-19 food response. We have many community organizations. We have around 6 or 7 nonprofits, and then we have many state and federal agencies as well. So together, we're trying to address COVID from a multi perspective of how to address food insecurity in the city. Next slide, please. So being housed in the Department of Planning, the first thing we did was look at best practices, community-informed data, and also use the existing networks we had in place, our Food Policy Action Coalition, our Resident Food Equity Advisors, and the partners and relationships we've already established in the last 10 years. Food environment mapping, in collaboration with Hopkins, we've done extensive food environment mapping with healthy food priority areas, formerly known as food deserts. And to tell you the truth, it was irrelevant for COVID-19. Data goes out of date so fast that we didn't feel like it was a clear indication of the current status, with unemployment rate soaring and with SNAP enrollment increasing. So therefore, we use a different mapping structure, and we use SNAP. So what we learned from our SNAP data that we now get on a monthly basis is that we had a 5% increase in SNAP participation between March and April, but that's just who was enrolled. That was not necessarily who applied, just big note there. So that's 83,000 households. And right now the numbers are showing, according to Hopkins, 1 in 4 residents are food insecure in Baltimore, but I'm expecting that number to increase to 1 in 3. The evidence just hasn't come out yet. Next slide, please. So what you'll see here is our map. It looks very similar to our Healthy Food Priority Area maps, but this is SNAP data instead of our Healthy Food Priority Area definition. And we use that information along with low-income immigration data that we didn't necessarily put on the map, but we used it to identify where we should be doing food distribution in Baltimore City. So once again, this is supposed to look confusing because it is. There's a lot going on, and that's intentional. So in food distribution, we have 44 sites that are providing grocery boxes. I'm going to go into details later. And 43 sites for produce. And then we have a tremendous amount of meals being served daily for older adults and youth. And then we also wanted to acknowledge and put onto the map all the food pantries and nonprofit organizations who are doing community-driven response. So this is what the compilation looks like when you overlay it with the with the SNAP data. Next slide, please. So I want to talk, one of the priorities of our work is on food distribution. We want people to stay home. And we want them to have enough food to stay home. So at least they don't have to go out for food. If they have to go out for other services, that's fine, but we don't want food to be the primary factor. So with that, we launched the grocery boxes. That's a contract with the Maryland Food Bank, and it's enough food, 30-pound shelf-stable food to last a family for a week. I would really consider it more like a backup box. If you have no food in your house and you need food, this is shelf-stable food. And we were in partnership with National Guard up until June, which has been great. And we have distributed over 70,000 grocery boxes at 44 sites. And that's approximately 280,000 people. And so this is one part of our solution. But the second part is our relationship for the produce boxes. And this is through USDA Farmers to Families Food Boxes through Coastal Sunbelt, our local produce distributor here, or one of them. And it's a 20-pound box of produce. And those are, we've had 40,000 boxes distributed at 43 sites. So that's approximately 160,000 people. Some of these sites are together, some of them are separate. We have a community-driven response, meaning that we have a lot of community planners in our Department of Planning who are reaching out to the nonprofits and really trying to get a pulse on the ground of what people need and where they need it. And then we're trying to accommodate our strategy as that. So as far as sites, community organizations, schools, rec centers, public housing, et cetera. And just so you know, like grocery boxes on average is around 8, and produce boxes is around 8,000 per week, just to put it into perspective. Next slide, please. So that's how we started, and this is where we are and where we're going. Is we really want to stay focused right now on increasing our numbers of home delivered grocery boxes. Because as COVID, we want people to stay home. We don't really want them to congregate in spots, even to pick up food. And so through our partnership with Amazon, which has been a phenomenal partnership, because they are paying their drivers to deliver our food, but we are not paying Amazon. So it's all pro bono, and it's phenomenal as far as the service that they provide. And we also are working with screening with 211, with our Maryland Access Point, which is the older adult line. And then most recently working with contact tracers and hospitals and anyone who's interacting with people who are COVID positive, and making sure there's a food insecurity screening. And if anyone needs boxes, we want to make sure that they get delivered. So at first we thought they could just be able to call the line and get the information they need, but there was a lot of nonprofits who stepped in and said, well, their wait lines are long, or they're nervous about giving their addresses to the city. So we created sort of a workaround with nonprofits where they will enroll them directly into the grocery boxes themselves and not have to go to the city, and then Amazon will drop off the boxes. So you can see here on this little flyer, we have it in 6 different languages on our website, but it is a screening. You need to be able to screen for this right now as far as being homebound, not have food available, and you can't get out of the house. Next slide, please. So this is lots of data. We are using lots of data. I'm not going to go into all the details, but you can see here the first one where you see the blue line go skyrocketing up. That is the grocery boxes. And it is very unpredictable. It goes up and it goes down and it goes sideways. And what we're learning, which I think distributors knew long ago, is that food is so unpredictable. But right now the numbers are still soaring high. The next one, which is the pie chart, it's really looking at the focus with, we got some suggestions from community organizations saying, hey, can the city give us grant money? And we didn't really have grant money to give them. We can have the philanthropy networks give them money, but what we did have is the ability to buy food and give it to organizations. And so that was where our priorities went. We were able to get the produce boxes from Coastal, which by the way, we did not pay for either. USDA is paying Coastal and distributing it on our behalf. And making sure we focus where organizations need the most support. And so that's why you see so many 10,200 boxes to community organizations. The bottom one is just showing you the representation and proportion of the types of grocery boxes that are being distributed, but I'm not going to go into that detail. Next slide, please. All right, once again, a map, all those really light dots that you cannot see. This is our COVID-19 map. And so the circles around the zip code is showing where there is COVID. And so the purple is where you have the highest COVID. The blue are the next highest. We were just showing the highest rates of COVID. The little yellow dots are the home delivered boxes. So what you can see is through our partnership with Amazon and our home delivery that we are targeting the neighborhoods where we're seeing an increase in COVID. And there's more work to be done for sure. So this is just another example of how we're using COVID data and helping to direct where we want, where we see COVID outbreaks. We don't want to see public sites. We want to see home delivery. So we saw in one neighborhood in one area that we had a spike in COVID. And so we distributed our boxes and we gave 650 grocery boxes to 2 nonprofits serving the Latinx community where there was a hotspot. And so the purpose of our strategy is to be responsive and flexible. Next slide, please. So in addition to that, we have meals. Going back to the resiliency report, we already had contracts in place. We already had a contract in place in times of emergency for youth. We already had contracts in place for older adults. It was just about activating them quickly and getting them mobilized and increased. So to date, we have around 3.3 million meals served through older adults and children. Next slide, please. When we talk about resiliency, so much of COVID-19 has been immediate food response. It has been about hunger. It's about just like the gap of the hunger gap that has hit very quickly in Baltimore due to COVID-19. But with food resiliency and urban agriculture, this is an opportunity to help get more funding into farming, into farm incubators, into food resiliency, money that can come in now that can stay in our communities. And so we've done a lot of work to support existing nonprofits and organizations to have funding for food resiliency and for farming specifically. We've also been working with the farmers markets with social distancing measures and really trying to, as a city, as far as funding goes, we were able to leverage $2 million of state funding, and then we were able to leverage CARES funding for around $6 million. And to date, we're really trying not to use any philanthropy. We want philanthropy to go to all the nonprofits who are feeding in Baltimore City. Next slide, please. SNAP. So online SNAP is something that Baltimore has been active advocating for a long time. And we started with trying to change it in the Farm Bill, and then we became a pilot city. And then right before COVID, we asked if we could get online SNAP, and they said, no way, not possible. And then COVID came, and then the mayor put a letter into the governor, and 3 weeks later, online SNAP launched. So that is very exciting. It has happened way faster than we imagined in the last month. So online SNAP has launched as of May 28th. I'm not going to go into details here, but we also have pandemic EBT, which has also going out this week. Next slide, please. As far as what we're doing and where we're going, when we look at the stages of COVID and our response related to food, the first phase, March through June, has really been about getting food out. Meal distribution, grocery distribution, trying to get we're all building planes and airplanes and submarines and everything simultaneously while operating. And that's what this has been about, just getting as much food out and getting the systems in place. Now that we're in that, we're in the summer strategy, which is really now focusing in on, now that we have the home delivery model in place and the mechanisms and the referrals in place, we really want to continue to grow that and reduce the need for people to go out of the houses if possible. And also continuing to add produce boxes into our home delivered grocery strategy. Then what we're looking forward to starting for September through February is that food resiliency COVID-19 strategy. How do we adapt our existing food resiliency plan to a COVID food resiliency plan, where we're looking at a response, but also long-term recovery, engaging stakeholders to create the plan, looking at evaluating an assessment of what we've done to date and how we can do it better in the future, and really looking at what is the city's role in long-term food insecurity and what are the other stakeholders' role. Next slide, please. So, reflections. It's COVID-19. We've had so many challenges. We've had challenges on data, which then resulted in learning how to use the SNAP data to create the COVID-19 food environment brief. So we overcame part of this, the data piece, but we never expected a backlog of SNAP not getting processed through the state. So even though we got the system in place, there was a lot of people who were not getting through to be enrolled. And then also now the newer information is, why is everyone getting denied? So data continues to be an ongoing issue, but we did create this brief and we'll update it as we get new data. Transportation has been a huge barrier as far as how do we move food. So the first solution we've done is the National Guard, and they have been phenomenal. They have been moving the majority of our food. And then in partnerships with Coastal, they are now moving the majority of our produce. And now in partnership with Amazon, they are now moving the majority of our home delivered. It's all phenomenal until any of these businesses who are doing this all pro bono back out, then it will be a challenge again. But right now we have come around and found sort of the opportunity to that barrier. Communication has been a challenge because up until now we have a joint information center and everything has to go through it. And sometimes things go in but don't necessarily come out, and they need to come out because people need to get their food. So there's always this issue of sort of flow of what information needs to get reviewed, what does not. Staffing has also been a challenge. We have a core team, but because this response was so significant, we then were able to reallocate a whole bunch of staff from different mayor's office agencies, have reassigned duties. And that was great until the city reopens, which they're reopening. And suddenly we have built this entire system based off of the staff. And now everyone's going back to work, and thank God we have a staff of 4, but we really could use a staff of 20. So that's another piece. Supply chain has been a challenge for everyone probably across the nation, from grocery stores to food banks. And procurement contracts, we had great procurements in place for our meals, but not necessarily for grocery and produce. So I already talked a bit about our accomplishments. We had the funding and the produce. The Emergency Operations Center, we were already embedded in the Emergency Operations Center, and we had a seat at the table, which allowed us to leverage the state money really quickly. And to be able to sort of get a pulse from the inside of how to put food into the city's response. Next slide, please. So that brings me to my concluding slide, which is resources. This is an example of the public map we built right when COVID started. Within 48 hours, we built out a public map that kept growing over time, where people can put in their address and figure out where to find food. You can see our website, and also if you want to see our COVID-19 food environment brief, that's available. That concludes my presentation. Thank you very much.
Thanks, Holly. I am going to stop sharing and turn it over to Edwin.
Thanks so much. It's Edwin Marty, Food Policy Manager, City of Austin. Let's see if I can share my screen. How does that work? Showing up good? Excellent. All right. I'm going to walk through a couple of things that we've been working on at the city in response to COVID-19. You'll hear some pretty similar stories from Indianapolis and from Baltimore. A couple notable differences though, and then I think we'll take time for questions once we wrap up all our presentations. So my role as the Food Policy Manager at the City of Austin was created about 6 years ago. It was embedded within the Office of Sustainability. I was the first staffer in this role and the first staffer to think strategically about the role of the city of Austin in the food system. Up until my position was created, the city of Austin had a food policy board and numerous staff embedded throughout the city responding to issues in the food system and regulating the food system. But my position was created primarily to help think strategically about what we should be doing within our food system. And so I've been working for a number of years on those issues. But this pandemic has really illuminated a number of weaknesses in the approach that we'd had to working as a food access group within the city of Austin. We've got a lot of lessons learned that I'd be happy to share. So let's see if I can get this to work.
Edwin, can you speak up just a little bit? People are having a little trouble hearing you.
Sure, I'll try to speak clearly. So a little background, the city of Austin is the 11th largest city in the country with about 1 million residents. The MSA, the metropolitan statistical area, is quite large, 2.5 million people. Pre-COVID, we had a large income discrepancy and significant health disparities along racial and demographic lines, significant food insecurity with disproportionate rates in communities of color. We had an incredibly robust economy, one of the fastest growing cities in the country for years, and really impressive job rates, etc. However, very little local food economy. We produced almost none of our own food. We had very little local food going into the food processing sector. And so we had some pretty big weaknesses that have been exacerbated by COVID. So when COVID hit in March, was fairly slow to spread. We had some really good local responses, but as many of you are seeing over the last couple of weeks, some really dramatic increases in infection rates that we were all very concerned about, and we'll touch on that more. So background, when COVID hit, the City of Austin, Travis County local governments created our Emergency Operations Center. Austin Public Health took the lead on the creation of a social service branch. They asked the Office of Sustainability's food team to take on the food access response. It's worth noting that this was a new part of the Emergency Operations Center. Emergency Operations Centers are created anytime there's a natural disaster. However, recognizing this pandemic was likely going to last much longer than a typical natural disaster, the EOC decided to create a social service branch. So within the branch, there are a number of task force, priority populations, equity, and food access being a couple of those. So we took on the role, my team of two and I took on the role of leading the food access task force. We were able to build upon existing relationships, for instance, with our food policy board's food access coordination group, and more or less transfer those into our food access task force. Our primary roles within that task force were to provide coordination of emergency food, response, communication internally and externally, and tracking and identifying funding and policy issues. So we settled this up the first week of March with a very small bare bones team. We've been working on 4 major areas that I'll walk through quickly. So food access and emergency food. We, as I said, knew that there was existing significant amounts of food insecurity in our community. Most of that food insecurity did run along racial demographic lines. Essentially, Hispanics and African-American communities faced much greater levels of food insecurity than white communities in Austin. Not surprisingly, we're seeing those exact same lines trending upwards as we're tracking the impact of COVID-19. That said, we knew that and had already identified a number of groups to work with. We had a priority populations task force that we've been working with closely to try to identify and understand the specific and complex needs of those underserved communities. So our first job in March was to get a couple of programs up and going, somewhat similar to what Baltimore was working on these priority populations, starting first with our populations experiencing homelessness. We had a very patchwork network of response to feeding the homeless in Austin. Similar to most cities, it was a combination of faith-based organizations, a little bit of government, and a whole lot of individual effort. So we tried to step in and tried to support a more unified process. We developed a program called the EAT Initiative, or Eating Apart Together, which was a combination of a collaboration with the food bank, delivering thousands of bags of groceries to be distributed directly to people experiencing homelessness, and then a meal distribution program to support and augment the existing agencies work in feeding the homeless. So we got an external contract with Revolution Foods to provide those prepared meals, and then we're able to work with our food bank, allocating additional resources from the city so that they could continue to expand their grocery box bag delivery program. In addition to working with the homeless populations, we also have been working hard on PPE or personal protection equipment for organizations that work with our priority populations in terms of food access. So getting masks, gloves, hand sanitizer, etc. Was a tremendously important part of our work, recognizing that most of the agencies that had traditionally been involved with emergency feeding were vastly under-resourced, both in terms of staff and money, and COVID disrupted their funding mechanisms substantially while increasing their cost of operations. So this is a primary and really critical thing that we recognize, that our food access programs were all based on, or mostly based on, nonprofit organizations who were having serious difficulties continuing their operations. So getting personal protection equipment to those organizations was critically important. We were able to get things routed from our Emergency Operations Center directly to organizations to ensure both the safety of the staff distributing food as well as the clients and populations receiving that food. In addition, we worked closely on direct distribution of groceries to individuals, a whole range of different programs, primarily working with our food bank, augmenting and supplementing existing meal distribution to individuals. As Holly touched on in Baltimore, the entire model for emergency feeding really shifted during the pandemic. Traditionally, municipalities and nonprofits have relied on congregate feeding, bringing food insecure populations together and feeding them at one time. This model simply does not work during a pandemic with infection potentials. And this is, I think, probably the critical thing to think about in terms of how this whole emergency food operation has differed from previous efforts. It was not possible to bring people together to feed them in large quantities. Instead, individualized responses were necessary to develop. So for one, all of the planning that we had done as a city and planning that most of the organizations and nonprofits working in the space had done previously to the pandemic were basically thrown out the door the first week of recognizing the severity of this pandemic. So an entirely new program was needed in terms of how to provide individualized food distribution, either drive-through, walk-up, or even more importantly, home deliveries. So the challenge there, of course, is that congregate feeding has been the model for emergency food response because it's cost effective and it's very efficient. You can bring large quantities of food into one place, bring large quantities of people together, and get that food to those large numbers of people. When you disrupt that model and try to rely on individual distributions, the cost of distribution goes way up, the efficiencies goes way down, and you're basically just in need of a lot more money and a lot more staff to get that done. So fortunately, we're able to work with a number of different organizations and pivot from congregate feeding to individual food deliveries. And I'll touch on that in a separate slide in more detail in just a second. In addition to the immediate responses, though, we also worked closely with our farmers market. We've got about 15 farmers markets in the Austin area. Initially, there was very significant concerns the farmers markets would be forced to close. And we were able to work very closely with our local elected officials and the Emergency Operations Center to ensure that farmers markets were considered essential services, just like grocery stores, which they are, and ensure that that was embedded within the policies of our shelter-in-place ordinances. So our farmers markets never closed. Each one of the farmers markets developed emergency safety plans and protocols, which were carried out, and we're happy to say that a significant amount of local food was distributed, sold to the community, and this had a significant economic impact in terms of keeping our farming community in good shape. Lastly, in terms of immediate initiatives, like many other cities, we spent quite a bit of time in the first few weeks of the pandemic working on food recovery. So many restaurants had been closed with all of their perishable goods sitting in refrigerated spaces needing to be redistributed. We were able to develop a unified process for our food bank and local food recovery agencies to work in tandem with the city government and county governments to ensure the most effective and efficient food recovery process. So we're very happy to report that through some really good just internal collaboration, we're able to recover huge amounts of food instead of seeing that food go to waste, getting that to appropriate places, either food pantries or other locations. We're also, in addition to those things, continuing to work on food access needs on an ongoing basis. One of the biggest issues that we see is with the closing of schools. Our local school districts have done a fantastic job of standing up drive-through meal distribution programs, which have been able to ensure that parents can come to schools and pick up food for their children. In addition to that, though, we recognize that if we were able to develop a program where the adults, the parents, the caregivers were also able to pick up food for themselves in addition to their children, we could increase the efficiency of that operation, decrease the number of times as families would have to leave the home. So the City of Austin was able to allocate substantial funds, a couple $1 million over the last 2 months, to local school districts to contract with locally owned restaurant clusters to provide caregiver meals in addition to the student meals that they were distributing on a daily basis. This program has now been expanded and is continuing throughout this summer. Lastly, the WIC shopping pilot program is another really interesting initiative specifically intended to try to keep high-risk individuals in our community at home and limit the number of times that those family members need to leave the house. So WIC specifically is for pregnant and new moms and children. We were able to allocate funding to increase the staffing at our local WIC department so that WIC employees are actually able to do individualized shopping for specific WIC clientele. So getting a shopping list and going to grocery stores, shopping for those WIC clientele, and then delivering those grocery boxes to those family members. We're seeing some really good results on that, and really excited to see how we can pivot in recognition of the challenges during this pandemic. Communication has been a critical part of what we do. Interagency communication is probably the single most important thing that our task force has been working on, just to make sure that the lines of communication are open between the Emergency Operations Center and local government departments, and most importantly, the nonprofit sector that's doing the bulk of the emergency feeding during this pandemic. We have weekly, bi-weekly calls with all of the agencies working in this space. We document those unmet needs and get those things up to the Emergency Operations Center leadership team as well as to elected officials. It's been an incredibly effective process for communicating exactly what we're hearing in terms of needs in communities, and then being able to get those needs highlighted and responded to. This communication strategy has enabled us to get close to $5 million in resources reallocated towards those agencies that are doing critical work in the community. We're working closely with our United Way and our 211 hotline. We've been able to help stand up a parallel website to the 211 hotline called connectatx.org. It's been really effective in terms of getting all of our local emergency feeding agencies to update their information on the 211 call line on a daily basis in terms of hours of operation and location changes, which have been very dramatic and regular. So we've now got the most up-to-date information on the 211 call line and a parallel website with a map of food resources. So basically either phone call or quick web search will allow community members to find out the latest and greatest information about where they can access emergency feeding. We've also been working closely with our Food Policy Council and communicating issues and listening to our Food Policy Council and channeling those needs and interests and issues back up to our Emergency Operations Center. Food access and food distribution models, I'll just touch on these three very quickly. Unique models, we were able to work with a commercial kitchen cluster who was interested in augmenting prepared meal distribution. There were already a number of organizations providing prepared meals, but it was very clear in the first couple of weeks of the pandemic that the numbers of food insecure in our community were skyrocketing. We think it's probably double, if not triple. And so the city and the county were able to allocate resources to a group called Keep Austin Together, which basically opened commercial kitchens that had to be closed due to the pandemic, bring staff back on that had been furloughed, and tap into alternative food distributions, food supply chains to create very affordable meals to be prepared and then distributed. So about 6,000 meals a day were being prepared in these combination of commercial kitchens and funded by the city and the county. We're really excited to see both the economic impact of that as well as the direct needs being met in the community. Our neighborhood pop-up grocery model was in recognition that so many restaurants have been shuttered. And even as we were reopening, many of those restaurants were not able to fully create viable economic systems. So we also recognize, like many other cities, that there's significant parts of Austin that lack full service grocery stores or even just good places to get affordable, healthy food. So we contracted with a local nonprofit to develop a model for restaurants to pivot from dine-in services to food retail, connected them with affordable supply chains to local healthy food. So now these restaurants are able to supply food retail to their existing clientele in terms of providing affordable, healthy, good food retail, limiting the amount of transportation needed in the area. And then lastly, we've been able to support a new nonprofit called Good Apple, which does prepared meal distribution to seniors who have limited mobility and those that have tested positive for COVID, distributing about 10,000 meals a week, home delivered, healthy, fresh, tailored meals to meet specific needs of that population. Finally, the funding and policy has been a critical part of our work. We are tracking federal policy all the way down to local policy, communicating potential opportunities for policy changes or support or opposition. As Holly touched on, the changes to the SNAP rules were tremendous. This is something that was number one on our policy need, was to get a waiver for SNAP online in the state of Texas, and then overnight, because of the pandemic, that was granted, and we've seen tremendous impacts across the community in terms of the ability of so many of our community members who are SNAP eligible to be able to utilize that program, stay safe in their home, and have food delivered to their homes, or utilize curbside pickup, and limiting the amount of times that people have to go into the grocery store. The other major policy that we're tracking and working on is the pandemic EBT, which is a one-time benefit for parents of students who are eligible for free and reduced lunch. This has been a really impressive program in terms of the impact, but very poorly implemented. We spent tremendous amounts of time working on augmenting communication and outreach, specifically to the most vulnerable of our community members, non-English speaking as first language community members, to ensure that they understand how to get enrolled in this program, who's eligible, and then most importantly, trying to mediate the national dialogue around if participation in a benefit program that you're eligible for could potentially impact your immigration status. Here in Austin, we have a significant undocumented immigration community, many of whom are eligible for benefits like pandemic EBT, but who are very concerned about if participation in these programs could have negative unintended consequences. So we've been spending a fair amount of time working with not just internal City of Austin resources, but others throughout the community to try to address that issue. We have been also, in addition to those programs themselves, been allocating significant funding. We were able to, in my office, the Office of Sustainability, allocate about $50,000 of unspent funds due to our shifting programs, getting funding directly to nonprofit agencies working in the space. Austin Public Health received about $15 million from City Council in a program called RISE funding. The vast majority of that funding has gone to direct financial handouts to eligible community members, which we think is a fantastic way to equitably address needs in our community. And a couple of $1 million of the RISE funding also went to emergency feeding. Travis County has been working in tandem with the city in terms of funding. And then we also have our nonprofit sector coming together to create a fund called All Together ATX. So we've been working in that space now for 3 months and see no end in sight, which is why we're working on our data collection project. So as the others have touched on previously, I feel like we're kind of working in a fairly difficult space in that we had good information around food insecurity pre-pandemic, but we've had very little data to go on during this pandemic in terms of the scope of food insecurity due to the pandemic and economic downturn, as well as geographical information. So we contracted with the University of Texas School of Public Health to do direct data gathering and aggregation of existing information, primarily working with our United Way 211 call information. We should have a report delivered hopefully in the next day or so from the School of Public Health that documents the geographical locations of calls to 211 regarding food access issues, as well as demographic information. We're going to overlay all of that with existing food access locations to get a better picture of where our existing resources are addressing the liabilities in the community. We're also going to use this information in an ongoing project with the Dell Medical School's Population Health Department to do phone surveys, basically validating our 211 call information and following up on those call surveys with additional resources. So we're going to spend basically the rest of the summer trying to tease out exactly what this landscape looks like, where the unmet needs are in the community, and then how to communicate those unmet needs back up to our elected officials. So what's next? Working on continuing the funding for emergency feeding. We don't see an end in sight in terms of this pandemic and the need for a response. So our job is to figure out how to keep this emergency response funded. Working closely with our food policy board, who came forward last week with a very aggressive recommendation to city council and our county commissioners in terms of increasing funding for racial justice work in Austin as it directly relates to the food system, increasing funding for emergency feeding, and increasing staff support for this work. We're working in tandem with the region across Central Texas to ensure that as many resources as possible are shared collaboratively. We're hoping to turn this process into our regional food system collaborative, a formal collaborative in the next 6 months. We recognize the pandemic has illuminated numerous weaknesses in our food system, one of which is how local governments work in silos traditionally, specifically in the food system world. And so we're hoping a regional food system collaborative can get to the core of how to improve that system. And lastly, we're working with Johns Hopkins Center for Livable Futures on a food system resilience community practice project that hopefully will lead to a formal food resilience plan that we can have in place sometime later this year. That's all I've got. Thanks so much.
Thanks, Edwin. And last but not least, we have Latha Swamy. And Edwin, if you want to stop sharing, then.
Yeah, I can do it. I think. Did that switch over now? Great. Okay. Hi, everyone. I'm Latha Swamy. As Anne said, I'm the food policy director for the city of New Haven. I'll try to keep it brief since my counterparts in other cities have covered a lot of the topics and responses in their presentations that that many cities are seeing. I'll start the presentation off with a snapshot of New Haven for those who are not familiar with the city. Then I'll move into some examples of our COVID response. And then I'll wrap up with a few lessons learned. And knowing that I was fourth, I tried to make my presentation lean because I didn't want to be too repetitive. So New Haven is a small coastal city in southern Connecticut. As you see, the big arrow is pointing to it. The population is about 130,000, median income around 40 as compared to about 70 for the state. About a quarter of the residents live in poverty and about 50% of residents are designated low income. And as is true for most cities, racial and ethnic disparities widen when considering New Haven's 6 historically defined low income neighborhoods, which are predominantly Black and brown communities. So pre-COVID, this is a data snapshot of pre-COVID. So across the city, there was about there's a rate of about 22% food insecurity. That's compared to the Connecticut rate of 12% and the national rate of 13%. And as I mentioned, this primarily affects low income, Black, Indigenous, and people of color communities. And I wanted to highlight this because this obviously intersects very clearly with what's going to be the result of COVID and what we see happening around employment. So food security is notably higher in those who are not employed, about 41%. And then in those who are underemployed, about 54%, compared to those who have a full-time job. And these are specific to New Haven again. Also, around childhood hunger, about 56% of New Haven children live in households that receive SNAP. And around 94% of children were eligible for free meals in 2016 to 2017. And that's an increase from the previous school year. So this shows somewhat of a trend in increasing childhood hunger in New Haven. And so as has been mentioned by my counterparts, existing barriers to food access are further exacerbated during the pandemic. We know that food apartheid is a result of systemic and structural injustices like redlining and systemic racism and capitalism. So a crisis situation like COVID inevitably further highlights these systemic injustices. So in my work and with my partner networks locally, regionally, and nationally, what we've been working on is trying to respond to the immediate needs of the community. And my division specifically has been trying to plan for the longer term impacts with all of that in mind. So more about my division. The food policy director position was established in 2016. It was filled for a short time, but it was actually vacant for about a year. And following that, I entered the position just over a year ago. Our staffing structure is minimal. I'm the only full-time staff member, and thankfully, I inherited some grant money from my predecessor who secured this grant for a part-time food system administrator. So that's been crucial during the COVID response. As far as plans, we have a New Haven Food Action Plan. We have a climate and sustainability framework, but we do not have a comprehensive citywide food resiliency plan. So that has definitely been a challenge during this time because we had no kind of framework to build off of, even if the framework wasn't relevant to a pandemic. So the food policy division works across three primary priorities. We focus on projects that promote health equity, socioeconomic justice, and environmental justice. And many of our projects fall at the intersection of those three. And given that my division has primarily functioned, with just one staff member, I rely heavily on a coalition building approach. So I work extensively with other departments, institutions in New Haven, and through knowledge sharing networks from the local to the international level. And this really speaks to the kind of community-driven, resident-driven approach that a lot of food system advocates and stakeholders take in New Haven. And it's been important for building a movement around food policy change in New Haven. And so since I've been in the position for the last year, these relationships have been very important in my ability to respond to COVID with my staffing challenges and other challenges I'll mention as well around funding and awareness. So this is just to give you an idea of some of the partnerships that I have from the local to the international level. I work very closely with the New Haven Food Policy Council. We work in tandem on a lot of initiatives and projects and policy agendas. There are several other organizations like community research organizations that have large CDC grants that have been able to put into place networks that bring together different food system stakeholders. I've been working closely with the Food Service Task Force of the Board of Education. Witnesses to Hunger is a group that is made up of those who have or who are currently experiencing food insecurity. And again, I often refer to some of the plans that have been put into place. Regionally, I work with the Connecticut Food System Alliance, who's working on a state food plan. Food Solutions New England is working on a regional food systems plan and partnership. And Working Lands Alliance works a lot with farmers in the state and supporting them, especially through the COVID crisis. So as I mentioned before, primarily my division has served as a citywide convener and communicator. One of the things that we did, which I just mentioned, is activate daily calls with the Coordinated Food Assistance Network. As I mentioned, this is a group of emergency food providers and those who access emergency food. This group existed prior to the pandemic. So we had just started working and kind of putting together our guiding principles. So the pandemic really served as a catalyst to actually accelerate that work and then also highlight the important need for this type of network to exist in New Haven. So that was basically a godsend to me because with very limited staff, I wouldn't have been able to stand up many of these programs without this sort of network in place. So some of the food distribution efforts that we immediately focused on were targeted toward priority populations and meeting their needs. Just as in many other cities, we focused on youth with grab-and-go meal distribution at 38 sites. With seniors, we ramped up Meals on Wheels and established pantry delivery in lieu of congregate meals at senior centers. For the homeless and unhoused, one unique program that we put into place, it's called Square Meals New Haven, is we set up a rotation of restaurants to provide meals for those temporarily housed in hotels. And those individuals were moved from homeless shelters into hotels to manage the spread of COVID. And for low-income individuals and families, we set up a pantry delivery model for high-risk individuals. We work to support the continued operation of a distributed network of pantries. Our city has over nearly 70 pantries for a population of 130,000. So there is a wide network of pantries. We also helped set up neighborhood pop-up pantries. So these are some of the larger food distributions where we try to reach 500 plus households at a time. And also, as many others mentioned, we really advocated for online SNAP to launch in Connecticut, which just launched at the beginning of June. And a lot of our work around that has to do with transparent, clear marketing around how to actually go about ordering grocery delivery online using SNAP benefits. Similarly to others, we are also doing a lot of policy tracking. We actively are paying attention to COVID relief packages, any SNAP changes. As pandemic EBT was rolling out in states, we make sure that we inform our networks about how to actually go about using these resources and accessing them. And we also track other federal nutrition programs. So as far as lessons learned, some of the challenges, as I've alluded to throughout the presentation, really revolve around being essentially an office of one. And right now, it's been great having a part-time person work with me, but as Holly mentioned, rather than having just a few people working with you, it's really crucial to have many people, especially during coordination of a basic needs response for an entire city. Similarly, I've had some staff from other departments like economic development reallocated to work with me, but very minimally, maybe like 3 hours a week. Someone will work with me on a project. And this is compounded by a lack of awareness about my office and exactly what I do. This lack of awareness is both internal and external. A lot of people don't really know exactly what my office does and or what food policy really is. It's still early on in the life of this office. So some people in the city didn't even know I existed. Like many emergency operations staff, but now they know. And externally, there is a lot of confusion. People think that I provide direct services, but I do not. I do not have any funding, and I am not set up in that way to provide direct services. Again, I work with a lot of these networks, and like this coordinated food assistance network, and directly with pantries and other food service providers to augment services that they provide, but I myself do not provide any services. And funding has been mentioned by the previous panelists. Unfortunately, I do not have a budget at all. I have $0, and I have been allocated so far no dedicated money from for any kind of food distribution or otherwise any food programming. There have been a few funding funders that have come through, for example, for the restaurant meals, the Square Meals New Haven program. And we received some money from Yale University is located in New Haven. They've set up a community fund. We received some funding to make that happen, but that was very minimal. And so those three things have come up and persisted as challenges for me during the pandemic. And I'm actively working on trying to, instead of viewing them as challenges, seeing them as opportunities to talk to senior leadership about increasing staffing or increasing funding for my office. And then to end on a positive note, COVID-19 has also helped me catalyze a lot of relationships, inspired by a lot of the data stuff that Holly's doing in Baltimore. I was able to connect with people in the city, like our GIS specialist, to launch some mapping and data collection tools. They're not as extensive as the other cities yet, but I take that as a win. It's been really great. Similarly to other cities, this is an opportunity also for me to do some resiliency planning. Before COVID, I was focusing a lot on urban agriculture and land ownership and transparency in the process, and that's very relevant to kind of resiliency planning. So that has been coming back into my work after pivoting from the kind of immediate response. And then I'll end with one local policy change. With COVID, it's helped highlight for the city at large the need for meals for children throughout the year. And during summer, we have summer meals, but then we have a gap of about 2 weeks before school starts when the central kitchen is closed and there is no school meals provided to children in the entire city. And we call that the August school meal gap. A lot of food system advocates have been working on this for years, trying to find a solution. And we think that with increased awareness around the dire need for school meals for kids throughout the year, this would provide kind of a policy lever for us to actually have a win around solving this issue in the coming years. So that's all I had. Hopefully I kept it short enough.
Thanks, Latha.
Yeah, thank you.
And we have about 10 minutes for questions. This is for everyone. What new strategies should be permanent to assist communities during the 6 to 18-month period after COVID-19 resources have expired? So anyone can feel free to answer that.
For us here in Indianapolis, the one thing that became really apparent was the fact that we needed to have some type of permanent warehousing, aggregation, and distribution center in place. We need a food hub. And if we'd had a food hub prior to COVID-19, we would have been much better positioned to be able to handle all of the challenges that we faced. Trying to stand up a makeshift warehouse and distribution center in our football stadium was just something I didn't think we'd be able to do. And if it weren't for the fact that we were already so well connected within our community, it wouldn't have happened. But we've already applied for 2 grants to start work on the feasibility study for this. And so hopefully that's something we can move forward rather quickly.
Great, thanks, Milele. Anybody else on that? Milele, I have another question for you. The Community Compass app sounds great. Wondering if it also works across other safety net programs like Medicaid. Has the city made any effort to look at streamlined eligibility for beneficiaries?
We have. Originally, we named the program the Food Compass because we were specifically thinking of food access and insecurity. And then we changed the name to Community Compass because we realized that this platform has the ability to reach out to families in many different sectors. And so we wanted to be able to develop it with the capabilities and market it with those capabilities in mind. Right now, it's just within Indianapolis and Marion County, but we do have talks to be able to get that Community Compass statewide and to be able to work with both FSSA and other agencies to be able to get all of the assistance needed in one location. Very similar to 211, but in an app that residents can access.
Great, thank you. This is also for everyone. How are you engaging food insecure residents in your areas in developing responses to the COVID-19 pandemic?
I can speak to that first. So we had the resident equity advisors, and we had a cohort of advisors from the Housing Authority of Baltimore City. And we were in the middle of mid-session of the advisors when COVID-19 came to be. And so we had to stop or alter that. And so we engaged them back via phone calls and actually Zoom. And it turned out that we thought it was going to be a barrier, and they were able to be responsive and on the calls. So one of the things that we got residents' voice from the Housing Authority of Baltimore, and then we also reached out to our Food Policy Action Coalition and organizations working with them. I think that the biggest challenge for us is communication. There's every organization and every church and every person and every resident is engaged, and how to be coordinated in sort of the responsiveness, I think is one of the things that we definitely work hard to address, but it still remains a challenge.
Would anybody else like to address that?
Yeah, so I mentioned the group Witnesses to Hunger, and I've learned a lot about the resident equity advisors in Baltimore. So in New Haven, Witnesses, I feel kind of fills a similar function. They are, as I mentioned, a group of individuals who have experienced or who are experiencing food insecurity, and they're very active, and they're big policy advocates, especially on the state level. And this has activated them to be, they already were, but even more active on the local level. They've also provided crucial information around gaps in the city where food distribution may be lacking. And they've also really informed a lot of the ways that food distribution is implemented in the city. And so it's been really great. That's been a long-standing relationship for years, and they've been very active in the community. So that was a great group to tap into right away.
Great, thanks. How are decisions made on how to spend the relief funds and what programs to expand or create. Again, this is open to anybody.
I can touch on that. In Austin, we had, all of our city council meetings and boards and commission meetings moved to a virtual format, which was really problematic. And there was a lot of concern that the community voices were going to really be shut down as a result of the moving towards a virtual community engagement. That said, we have seen skyrocketing participation in citizen communication at our city council meetings, county commissioner meetings, and our boards and commission meetings. Just for our food policy board, for instance, we had probably triple the number of people contributing to the citizen communication portion of our formal meetings. I think city council had 4 hours of citizen communications before the actual meeting started a month ago. So pretty impressive and broad effort to get out in the community and make sure that a huge number of people understand how to get engaged on those communication tools. We heard in terms of the funding that was going to be allocated from the city council to respond to COVID, unequivocally hundreds and hundreds and hundreds of people called, emailed, voiced their concerns that direct financial assistance was the single most important thing that our city council could be doing in terms of response. So really, I think pretty impressive given the massive limitations that we have just as a community and in the structures to actually have in-person engagement. But really, really cool to see such a large number of people contribute to directly deciding how to allocate our funding.
Great, thanks, Edwin. How did each of your teams ensure the programs you were developing were not duplicative of other initiatives in the city? Great question.
Maybe I could start as the smallest, most manageable city probably on that end. So at first, I think I got really stressed out about trying to be very coordinated and centralized. But I realized that the best way to go about not duplicating efforts is to invite, once I heard about other, say there was another delivery program that a clinic was doing in a certain neighborhood, it was to invite them into the group that's coordinating pantry delivery and then sharing resources. So we mainly focused on, okay, well, you don't have routing software, so please join the group when you can, but we'll plug you into these resources so that you can better and best do the work that you're already doing. So with that, I started collecting what all community things were popping up that weren't so centralized, and just creating a master list and making sure that those were advertised on the city website with everyone's permission as resources. So there was knowledge of all that was going on, especially, around mutual aid networks. Mutual aid is doing a lot in New Haven as well. And I think kind of lifting up the work that's already being done well and addressing specific populations, say immigrant and undocumented, where the city wasn't really filling a role. That was really important. So we just think of it like a patchwork and try to make sure that there are no gaps in the quilt.
Great, thanks, Latha. And then finally, we're going to do one last question. What strategies have you used to identify and collect data on the community-based food distribution efforts that have popped up during COVID?
I can speak to that. So it turns out that we had some folks in the Office of Sustainability whose time became free because they were working on all these projects. And one of these people was really active in the grassroots community. And so she took it on, which has been phenomenal. She's been reaching out to all the grassroots organizations and doing a Google form and assessment and collecting the data weekly of what are their needs, and then doing some matchmaking, which has been really phenomenal for us because we're trying to deal with a large, very big city response. And then we have a point person now who's working on getting the tools and the needs and assessment of all these community organizations.
Thanks, Holly. We are 1 minute over time, so I'm going to stop there, and I'd like to thank Edwin, Holly, Milele, and Latha for joining us today. We really appreciate all your insights and know that it is an incredibly busy time for you. So for you to take an hour and a half out of your already very full days, I know you're working probably 12 to 14 hours, is saying something. So we really appreciate it, and I hope everybody enjoyed this as much as I did. Take care all, and we look forward to hearing more about what you're doing in the future. Thanks.